It took my doctors 10 years to find my diagnosis. It took ChatGPT 10 seconds. I wish it was a story about how AI saved me, but it's not. By the time ChatGPT existed, I was already lost 10 years to a bed. I spent my night reading medical journals because no doctors would listen to me. And I taught myself medicine from bed because the system has abandoned me. I was a detective in a case where the only evidence was my own body. And I had one hope, that it's not all in my head, like the doctor said. Only years after my diagnosis, when I finally had a chance to put my symptoms into ChatGPT, I realized that it took him 10 seconds to uncover a medical mystery that took me 10 years to do. In this moment, I saw it. AI is much more than funny cat pictures and better emails. AI can be the greatest medical revolution in our lifetime, if we let it. But what kept me up at night was this question. If AI can solve a medical mystery by the time I can tie my shoes, why should I even bother and go out just to meet another healthcare professional who is burned out? But maybe it's not even the right question to ask. Maybe it's not if AI should or could replace our doctors. Maybe the right question is, can AI restore humanity into healthcare? And in order to answer that, I have to be brutally honest about the state of our healthcare system. So why did it take doctors 10 years to diagnose me? It's not only that our doctors are extremely burned out, they're staring at screens instead of looking you in the eyes. They are working in extremely flawed systems. The same system that can dismiss a pain of a woman for 50 years as anxiety, or judge patients by the color of their skin, or tell somebody like me, it's all in your head. Human gaslight, human ignore, humans make mistakes. This is the system we have right now. And into that system, we are pouring AI. And the terrifying thing that is happening, many patients are starting to trust AI more than they trust their doctors. You see, AI doesn't have a bad day. It doesn't gaslight you. It doesn't judge you by your clothes or financial situation or the color of your screen. And it also doesn't tell you that you're faking it or it's all in your head. AI deals with facts, data, numbers. If trained wrong, it will mirror or reflect our worst disparities, biases, and mistakes. But if trained right, it can make healthcare better, less expensive, less bureaucratical, less biased. So, maybe we are using AI in the wrong way. AI in healthcare should be like an autopilot on a plane. It deals with immense amounts of data, chart the course, and keep the plane steady. But there is always a human pilot in the cockpit with their hands on the controls, accountable, responsible. And the key is, autopilot is not replacing pilots, it frees pilot. We let AI do what it does best, analyze and process data at a superhuman scale, suggest diagnoses, and outline a course of action. That empowers the doctor, the pilot, to finally reclaim the freedom to engage in activities that only a human can. Dr. Kedar Mate said, kindness is the most underrated technology in healthcare. And oh boy, do we need this kindness in a society that is slowly drifting apart. But this kindness is not only what we need as patients. We need somebody to listen to us. We need somebody to care, somebody that holds the space. And by holding the space, we are creating better healthcare. But let's think about something for a second. AI can read your lab results, but it cannot read the room. AI can listen to the words, "I'm doing fine," but it cannot understand it means I'm falling apart. This is the human-sized gap. So imagine you tie your shoes, you leave your home, and then you hear the words, "The doctor will see you now." And for many, many years, the doctor take her chair away from the computer screen, looks you in the eyes and say, "Okay, machines handle the what. Let's talk about the how. How does it make you feel? What are you most afraid of?" Machines handle information, human handles transformation. We shouldn't reject technology. We should wield it in order to reclaim what the system has stole from us. Time to listen, space to connect, and freedom to care. Should we be afraid of it? Not if we build it right. The technophobia, the ethical tightrope, the trust issues, those are not stopping signs. Those are design instructions. Because this is what I know, bone deep, from all those hours spending in that bed. AI can process data, but it cannot process grief. AI can find patterns, but only a human can find hope. AI can suggest a diagnosis, but only a human can help you live with it. Algorithms do the heavy lifting, humans do the healing. In a society where artificial intelligence is growing, the most powerful algorithm that we have in healthcare is and will always be the human one. Let's build a future where the algorithm sees your chart so your doctor can finally see you. Thank you.